If you've ever walked into your practice and thought, I can't take another day of putting out fires, this podcast is for you. You became a healthcare provider to help people, not to spend your nights worrying about payroll, insurance claims, whether claims were filed, and why your front desk can't keep up. Somewhere along the way, your dream of running a practice turned into the nightmare of your practice running you. That changes today. Welcome to the Growth Advantage. I'm your host, Travis Lairson, business coach, consultant, and founder of TLN Consulting Group. I spent years helping healthcare practice owners transform their operations into scalable, self-running businesses that don't depend on them to survive. Each week, we'll dig into the strategies, systems, and leadership habits that create smarter businesses, stronger teams, and scalable freedom. In this first episode, I want to share what the Growth Advantage is all about, why I created it, who it's for, and what you'll walk away with every week. You'll hear stories from real practice owners, frameworks you can apply right away, and lessons I've learned coaching hundreds of entrepreneurs through the ups and downs of building a business that works without them. Why did I start the Advantage? Why did I start the Growth Advantage? I remember being in the automotive consumer finance lending space for about 20 years, and then I switched over into healthcare. I had always wanted to be in healthcare, and I made the switch. And one of the things that I remember was watching healthcare practitioners own practices that were, to the outward facing world, ridiculously profitable, ridiculously well off, ridiculously um, effective and efficient. But behind the scenes, that's not what we saw. We saw business owners that were sometimes going a month or 2 or 3 months without getting paid just so that they can make sure that their staff got paid. Healthcare directors that were seeing practices that were physically seeing patients, but revenue cycle management wasn't processing, couldn't keep up. They weren't getting paid. Their clients weren't paying for services that had already been treated and completed. Practices that were really 2 or 3 claims away from closing their doors and not being able to survive. On the flip side, we saw multiple practices that were so inundated and overwhelmed with the number of patients that they couldn't figure out how to put together a schedule so that they could see all those patients, probably see even more, and become even more profitable in the process. It's a two-edged sword, and oftentimes, every practice owner lives with both edges of that sword. And that's when I really decided that it was time to actually help business owners, healthcare providers figure out how to overcome their objections, how to remove the bottlenecks from their business, how to build systems, how to put in team management concepts and leadership that would help benefit your team the most effective way possible. So that's why we started the Growth Advantage. Who's this podcast for? It's simple. Clinicians who want to transition from operator to entrepreneur, practice owners tired of working harder for marginal growth, leaders ready to invest in systems, people, and mindset. We'll look at a chiropractor seeing 40 patients a day. We're going to look at a med spa that is looking to open their second practice. We're looking at a fertility clinic that has 2 practices, has 4 practitioners, and needs a little bit of help in making sure that they maintain profitability. We're going to look at the entire gamut from chiropractors to optometrists to ophthalmologists to dentists to oral surgeons to the fertility space, which is near and dear to my heart. I spent a number of years in that space. We're going to look at med spa owners and TRT physicians and clinics and figure out how to help each one of them move. The Growth Advantage community is for those ready to lead their business instead of being led by it. So, what can listeners expect each week? 30 to 45 minutes, 1 episode per week. The goal is that the structure is going to be somewhere between 60% tactical strategies like systems, leadership, growth levers, and 40% are going to be stories, whether they be from clients, whether they be from other companies that I've worked with, lessons that we've learned, mindset, growth, thought processes. The guest mix, At the very beginning, it's going to be me. It's going to be me, myself, and I, and you're probably going to get tired of me. And I hope not. But later on, we're going to go through this process and we're going to start to bring clients and thought leaders in the healthcare industry in so that we can begin to understand different perspectives, learn from those perspectives, learn from their mistakes, learn from their triumphs, see what adversities they overcame so that we can actually help each and every one of you become a better owner and a better clinician. Some of the things we're going to talk about is hiring A-plus players, automating patient flows, creating team accountability, and scaling to new locations. So, our goal is that every episode feels a little bit like a mini coaching session. When you walk away with one piece of it, of tangible, actionable information that you can put into your practice today to help it grow before next week. So, what is our philosophy? The growth advantage mindset is a philosophy that creates freedom. It's a system that we put in place that creates freedom. It helps you develop teams that create leverage, and it provides you with leadership results that we can actually leverage to grow even more. One of the things that I find interesting is healthcare entrepreneurs oftentimes struggle with being able to run a business. And that's not a bad thing. That's not their fault. One of the things that we know is, we have doctors, dentists, chiropractors, whatever, that go to medical school, go to their doctoral programs, spend years in college, and never take an accounting class, never take a business class, never take a marketing class, because that's not what they're there for. They're there for learning how to help people. So now they graduate from college and they're on their own trying to build their own practice. And some of the things that they need to know, they've never been taught. And so our goal is to really help healthcare entrepreneurs understand those little pieces and parts that will make their lives so much easier. These are the people that literally save people's lives and create life on a daily basis. And yet, no one is giving them the lifeline to be able to grow financially, um, to grow freedom in their business. And so that's what we're here to do. We're going to look at leadership, team building, systems, scaling, scalability, and mindset as we go through. So we know that real growth is holistic and it's about the business and the person leading it. So we're going to make sure that we have a good cross combination of both of those things, the business and the person leading it. So what comes next? Next few episodes, we're going to talk next week about why most practice owners stay stuck in the operation or operator trap. How do we get them out of that operator track and really shift their mindset to break it? We're going to look at the freedom formula, building a practice that runs without you. Most states in the United States require that the physician is the owner of the practice. It can't give third party. Um, we're going to talk about that. We're going to talk about how can a physician own a practice and really build that practice that runs without them being there. We're going to then start talking about how leadership really starts with clarifying the message and the deliverables. Then we're going to look at mind shift sets, mindset shifts for scalable growth. That's just the first few next weeks. We're going to go from there and we're going to help you grow your business week by week by week. Please stick around. Please join us because I'm confident that we'll be able to help you. So here's what I hope that you will take away from this first episode. You don't have to stay trapped in the day-to-day grind. 2, systems and leadership are not more effort, but they are the path to freedom. And then this podcast is your weekly toolkit for building a practice that runs itself so you can lead a life that actually feels like success. You're not just running a practice, you're building a legacy, one system, one team, and one decision at a time. If today's episode resonated with you in any way, shape, or form, please subscribe to The Growth Advantage wherever you listen to podcasts. And for exclusive playbooks, templates, and growth strategies, join my Substack, where you'll get insights I only share with my subscribers. I'm excited to take this journey with you. I hope you're as excited about it as I am. Welcome to The Growth Advantage. Let's keep growing.